We are back with a look at the Ebola outbreak that's rapidly spreading across Central Africa and the global effort to contain it. The latest data from the CDC shows more than 300 confirmed cases across the Democratic Republic of the Congo and Uganda, with more than 60 deaths. Some officials suspect the actual death toll, though, it might be more than double that number. It comes as health workers on the ground are dealing with challenges from dwindling supplies and the lack of any available vaccine to prevent the spread of this rare strain. Well, now the outbreak has reached a militia-controlled region that is too dangerous for health workers to access. For more on this, I am joined now by Dr. Samantha Nutt. She's the founder of the humanitarian relief organization War Child USA in Canada and a board-certified public health specialist. Dr. Nutt, good morning. Thank you so much for being here.
Good morning, Savannah. Thank you.
Incredible work that you're doing, and I think you have an understanding that a lot of us don't of the region and of exactly what's going on the ground. You spend a lot of time in this region, so tell us just how tough this is. What is it like on the ground right now? What are your staff telling you?
This is one of the most challenging areas of the world, especially because when you're talking about the Eastern Congo border, this is the epicenter of that conflict. So you have to deal with roving militia groups. Access to populations in need is very, very challenging. Frequent attacks on aid workers, on health facilities. In addition to that, it's a very migrant population. This is the heart of the mining industry within Eastern Congo. People coming and going all the time, not just within urban centers and back to their communities, but also across local borders, which is why we have seen spread, for example, to Uganda. So you're talking about a very displaced, very impoverished community as well, facing a significant number of militia groups, which is very, very challenging all around.
And I mentioned this rare strain. Tell us what it is that we're seeing, how it's different, and how that makes it difficult to treat.
Well, this isn't a strain that we've really seen much of in the past decades. So the usual amount of research that has gone into other Ebola strains around identifying vaccines and monoclonal antibodies, which is the treatment that we've been using in other outbreaks, these do not exist. In addition, the testing has not been terribly efficient in regards to this particular strain as well. So all of these are combining to mean that we have very few tools in the toolbox, except for the old school business of contact tracing, following up, making sure people are isolating and following procedures and protocols. But this is all happening against a backdrop of very few resources, very limited capacity in a country where the health infrastructure is already under strain.
And as you just referenced a moment ago, war-torn regions. How is it possible for healthcare workers like yourself, for volunteers, for people to even treat people at all, even reach them in areas like this? How do you work against that backdrop?
I mean, to be honest with you, it's absolutely brutal. You're talking about having to deal with militia groups where most of those who are in them are between the ages of 14 and 18 years of age. They are heavily armed. You have attacks on aid convoys. You have looting of supplies. You have attacks on hospitals, on doctors, on all of those who are necessary to be able to provide continuity of care and support and identify those cases and make sure that we are containing this particular epidemic. So it is as I said, one of the most challenging places in the world. On top of that, we're looking at dramatic cuts to humanitarian spending. USAID cuts, but also other governments throughout the world have followed suit. So the usual resources, networks, the infrastructure, the funding, the capacity that would exist under normal circumstances and that have existed during previous outbreaks simply is not there. And that is very frightening.
You talk about the spread within Africa. There's obviously a conversation and a concern going on. Does it spread beyond Africa? What do you say to that?
That risk is very low. Ebola is not a very efficient virus in the sense that it requires pretty sustained contact. It's not a respiratory virus. You can't get it from sitting next to somebody on a plane. You have to have an exchange of bodily fluids. You have to have close contact. So in that sense, it's not like COVID, we don't have that same degree of worry, but it is something we need to follow, and we need to really be addressing it at its source. And the challenge is that at its source, we are seeing more cases, and we are seeing an underfunded response that deserves and needs urgent international attention.
And let's talk about that, exactly what people could do to try to help. Somebody watching at home and knowing that the humanitarian response has been very difficult to deploy, what can someone do to help?
The most important thing they can do is to actually invest in and donate to organizations that are involved in the region, not just in the Congo, but also in South Sudan and Uganda, other areas that have been affected. And in addition to this sort of acute phase and providing support to humanitarian organizations that are dealing with the front lines of this crisis, it's also important to remember there are a significant number of challenges facing this region stemming from ongoing poverty, violence, and instability, and addressing those over the long term, which is exactly the kind of work that War Child does throughout the world, reduces the vulnerability and reduces the overall global threat. We can't ignore conflicts and crises that are taking place, particularly in Africa. And especially, this is one of the worst conflicts that we have witnessed in the last couple of decades. More than 5 million people have lost their lives. It is not a coincidence that this is happening in the Eastern Democratic Republic of Congo. Those vulnerabilities are longstanding and entrenched, and we need to meaningfully address them over the long term.
Dr. Samantha Nutt, thank you so much. Fascinating conversation, really good information, and also about how we can all help. Appreciate your